Tens of thousands of couples across the country hoping to grow their families will walk by an empty nursery for months to come, all because of COVID-19, a sad consequence of the pandemic-related halt in many medical services. Well, joining us to talk about the impact here in the Lowcountry is Dr. Scott Sullivan, Vice Chair for the Department of OB/GYN and Professor of Maternal Fetal Medicine at MUSC. It's good to see you, Dr. Sullivan.
Thank you for having me.
So we've been reading articles about other parts of the country that has suffered from this. A lot of couples that were hoping to either start or continue fertility treatments were unable to do so. So that put quite a long gap in their ability to see a doctor and get the process going. So has that similar effect been experienced here in the Lowcountry?
Fortunately, it hasn't. Through a combination of a lot of hard work, planning, some luck in terms of how it hit here, we've really been able to avoid any significant interruption in fertility services.
That's great to hear. What do you think you attribute to that?
Well, if you remember back in March when really everything was shutting down, we shut down as well. Outpatient services, but it was really brief. It was only really 2 to 3 weeks, at which time we transitioned a lot of in-person visits to telemedicine visits. And really so the patients who were caught in that window had a very short postponement. And I'm not aware of anybody who missed a cycle or missed an important procedure. And then really during that time, we got our safety protocols and really ramped up the testing. So we were able to get patients back into the office really in short order. And it's interesting that even though the numbers of infections now are much worse than they were in March, we're back to normal operations because we were able to put everything into place.
That's great to hear. But let's talk a little bit about the risk in skipping treatments and all that entails fertility treatments for couples hoping to conceive. What does that look like for someone who's never experienced it before?
No, absolutely. Fertility treatments are by nature complex and involve a lot of precise timing. So the patient we were most worried about was someone who's already been in the process for several weeks or even months in terms of preparation. And then you have these medications or procedures all planned out. So if there would be an interruption, that would be the patient who would be most impacted. And fortunately, our interruption was so brief that really didn't happen. Now, other places where the interruption is weeks or months long, that's when cycles and things have had to have been canceled.
Now, let's talk about someone who's walking into your office for the first time and they're interested in pursuing fertility treatments. At that point, have they pretty much been diagnosed as not able to conceive without, say, IVF and some of these other methods?
It's variable. We have an entire group of subspecialists, fertility subspecialists here, and they really do a number of things. Some patients come in without a diagnosis, and so they need a diagnosis. Some patients have come from other cities where they've been unsuccessful. Some patients just want consultation, want advice. So it really runs the gamut. And sometimes it takes a while to do an investigation, a workup, and preparation before any treatments begin. And of course, there's a wide range of treatments. Some people may need something relatively modest and short, and some people need something very complex.
Absolutely. I want to hear a little bit more about that because I'm curious the timeline for most people, maybe the average patient, as well as what those treatments are. So we do need to take a break here, Dr. Sullivan, but when we come back, we'll get into all of that. So don't go anywhere. Welcome back. We've been chatting with Dr. Scott Sullivan. He is Vice Chair for the Department of OB/GYN at MUSC, and we've been talking about COVID-19 and how it's affected couples hoping to conceive. And in other parts of the country, we've learned that a lot of couples did not have any kind of medical treatment starting at about mid-March for several months. And for some couples, doctor, this could be quite devastating. I mean, are we looking at a couple that could have completely missed their window for hopes of conceiving, or is that a significant delay that could make things even more complicated by missing, say, 3 months of medical treatments?
I think that is possible for some more complex patients. I'd say for everybody, it's incredibly frustrating because the infertility process can be it can create a lot of anxiety. It's an emotional roller coaster for a lot of people, and then to have a forced hiatus for some patients who had planned or saved up money or had set their lives around what was coming, it can really be upsetting. And I think for some medically complex patients or patients who are on the or older and have less time to spare, so to speak, it can be even more medically significant. So frustrating for everybody, and for some patients, it definitely could be detrimental.
Sure. Well, we're lucky here in the Low Country because you said that MUSC pretty much didn't skip a beat when all this was going down. So you were able to kind of pick right back up much quicker than a lot of places around the country. Lucky for a lot of couples here. I wanted to also talk about some of the different methods of fertility treatment. So IVF being one of them, but that's kind of the last resort from what I'm understanding. I'm also curious what the timeline is for someone who's coming in for a diagnosis and then the process, how typically long that lasts. Maybe you can give us a little bit of an idea.
Sure. And of course, IVF, you're right, it is one of the more complex methods that we have. But some patients have to go right to that if with some diagnoses, right? But some patients who come in without a diagnosis or what we might call unexplained infertility might go through a progress. They might start simply with some medication for a few months, and then they may go through something like artificial insemination, and they may go through a number of tests for themselves, their partners, that type of thing. And then some patients may end up with IVF after going through that process. So it's definitely not a one-size-fits-all, and why everything is planned so carefully so that we can give the right treatment to the right patient. While our technology is very good and we have very good success rates, that some patients ultimately are not successful, and of course we tell patients that's possible, and of course there are alternatives, right, to other things we help patients with, like surrogacy, adoption, that type of thing.
Yes, so there are always other options, surrogacy and also adoption. Well, you've given us some really excellent perspective on this, Dr. Sullivan. And if I could just ask you one more question, we only have a few seconds left, but any new technology on the horizon for couples who are hoping to conceive themselves?
The one constant I've seen over my 20 years is that things just keep getting better in terms of our medications, our laboratory science, our technology. So I do think that offers optimism and hope for patients that progress will continue. So it's a constant process of research and translational bedside science. And yes, things are are better now than they've ever been, and I think that's going to continue.
I think that's a great note to end on. Dr. Scott Sullivan of MUSC, I want to thank you so much for joining us.
Thank you so much for having us.
We'll be back after this.